Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic.
The end of the pandemic gets closer every day, and yet baseless vaccine conspiracies are reaching epidemic levels of their own, like the biologically impossible idea that vaccinated people can somehow shed dangerous particles and endanger others. I know with the latest guidance, a lot of you guys have questions, and we want to get those answered. So here to debunk the conspiracy theories, friend of the show, Dr. Bernard Ashby, a cardiologist and Florida State lead for the Committee to Protect Healthcare. Dr. Ashby, so happy you're here. I'm going to go through these really quick because we're tight on time, and there are so many conspiracies and questions people have. I want to knock them out. So first thing, Bill Maher this week tested positive for COVID, as did several members of the Yankees baseball team. So that raised a lot of questions from people. How are they testing positive even though they were fully vaccinated? Can you debunk that or answer that question for us?
No problem, and it's always a pleasure to be here, Tiffany. I'm just messing with you. So it's important to realize what efficacy and effectiveness means. So the trials did show that the vaccine is efficacious at preventing COVID-19 disease, mild, moderate, severe, and hospitalizations to a certain degree. So when they quote the 94 to 95% and the 72% in the 94 to 95% in mRNA vaccines and the 72% in the J&J vaccine, that's what they're referring to is COVID-19 disease, which is caused by the SARS-CoV-2 virus. And so we have to put that in perspective. Now, in addition to that, we have to understand that the asymptomatic spread, what that means is not testing negative, okay? You can still test positive and not spread the virus, meaning that the vaccine is not a force field. I mean, if somebody coughs on you with the virus is gonna be there. Now, the immune response prevents the virus from replicating. So that does not necessarily mean that that individual will develop COVID-19 or spread the virus. And so it's important to have these caveats when we're explaining this to the general public, because there's a ton of misunderstanding. Yeah. And, the Yankee case is a good example of how that's been misinterpreted.
Thanks for that. So I want to ask about the mask, too, because I'm going to be honest, I'm confused by it. And I feel more comfortable wearing a mask when I'm indoors around a crowd of people. I'm curious how you would advise your patients, given that this is CDC guidance. It's not necessarily rules for local jurisdiction. And if people aren't honest if they have the vaccine or not, how can you tell?
So how quickly do we forget a year plus ago when we seen Asians on planes and in public wearing masks, and we thought that was kind of weird? Well, they dealt with the SARS-1 virus, they dealt with the MERS virus, and they understood the importance of protecting yourself and protecting your community. It's actually cultural at this point where if you feel that you're ill or suspect that you're ill, you wear a mask in public in a lot of these countries, like Japan, like China, for example. Right. And so now that we vaccinated the vulnerable population to a high degree, meaning 70+%, the CDC, I mean, this is conjecture on my part, has factored that into their decision making. If you look at the 7-day rolling average, it's been the lowest, our death rate has been the lowest it has been since April of last year. So this vaccination rollout has worked
so essentially, but since we're running out of time, essentially you're saying that it is okay to not wear our mask, that you would advise your patients to not wear.
So what I'm saying is that if you're immune compromised, you're concerned, wear your mask, speak to your physician. But if you're concerned, wear a mask. We're not moving into the chronic phase of this disease, and so we should be wearing masks on planes, irrespective of the pandemic. So and so I just want to make sure that we're clear on that.
And I just want to correct you. You mean people in Asian countries, not Asian American Pacific Islanders right here in America, but people in Asian countries were wearing masks. Really quickly, the silly conspiracy that the vaccine is injecting microchips in us. I find this the most ridiculous because everybody's very concerned. I don't want the government tracking me. I don't want a microchip. Hey, you don't want a microchip? You might want to get rid of this thing. But can you just debunk very quickly, we're way over, can you debunk very quickly this microchip conspiracy theory?
I mean, well, quickly, it's cap, right? It's not true. And the question that I have is, why do people insist on believing these things without any evidence to support it? And I think that's a question that we need to answer, because you have quite a few tinfoil cap wearing folks who are leading hundreds of thousands of individuals and giving them misinformation, disinformation, and they're believing it and eating it like Scooby snacks. So we have to, come back to the basics and understand, why are these people getting so much traction? And if we answer that question, then we could figure out how to combat a lot of this misinformation that's actually harming our communities.
Exactly. And share responsibly. Be careful before you share these conspiracy theories. So thank you so much, Dr. Ashby. Next time you come back, we'll have more time.